Hi, I'm Dr. Raheel Khan. I'm the medical oncology consultant, mainly doing GU, special interest in prostate cancer from Dublin, Ireland. Today, I wanted to talk to you guys about the PROTEUS trial that was presented at ASCO this year at the plenary by Dr. Talpin, and there was, of course, a New England Journal of Medicine paper published at the same time. On the same day. So I found that trial really interesting, and I'll be talking about it. Before I go into the merits and demerits and the significance, I would want to just give you a brief summary of the trial. So a PROTEUS trial basically is looking at the role of apalutamide in perioperative setting of localized high-risk prostate cancer. And we know that the relapse rates are high, and the method of the trial was 6 months of neoadjuvant treatment with apalutamide plus ADT, then radical prostatectomy, and then going into another 6 months of apalutamide with ADT. There were more than 2,000 patients involved. Primary endpoints were pathological response to the treatment, metastasis-free survival. Secondary endpoints, interestingly, included event-free survival, subsequent treatment, time to subsequent treatment, distal metastasis, and of course safety of the trial. If you look at the results of the trial, it was a significant difference in the pathological complete response rates, 8.9% in apalutamide plus ADT arm versus 1.0% in ADT alone arm. Median free survival, it's at 5 years, there was hazard ratio of 0.8, 78% in ADT plus apalutamide versus 73% in ADT alone. If with respect to the secondary endpoints, EFS, subsequent time to subsequent treatment, and distance metastasis, everything was positive. Most interestingly, has a ratio of 0.65 for the time to subsequent treatment, which I think is quite significant in a clinical setting. Looking at the significance of this trial, I'm quite excited about this study. I know there was a very mixed response to this trial, to the trial design and the results of the trial. My opinion is it's a first neoadjuvant positive study in prostate cancer. We've done so many studies in this setting, and we never had any clinically significant study in this particular area, although we have neoadjuvant treatment options for pretty much all other cancer and types before surgery. So I think it's a landmark study. It will be remembered as the first study which was actually positive statistically, and I think clinically as well. So that's one part, and the other part is that makes the study very peculiar is the use of PSMA PET scan. At the moment, there's so much confusion out here in the clinical setting because all the data that we use to treat our patients is not based on PSMA PET scanning. But at the same time, we are actually making all these decisions looking at the PSMA PET scans. For example, there is a big concern about labeling patients with oligometastatic disease when they are high risk, localized unconventional imaging, because at the same time there could be metastatic disease there based on the PSMA PET scanning, and you are saving patients from the morbidity and mortality attached to a surgery, which will probably not be beneficial in this case. But at the same time, there are concerns that the false positive scans are actually making a lot of young patients with high-risk disease from curative to non-curative. So this is the first ever study that we have actually used PSMA PET scanning, and this is the first trial that will incorporate our clinical practice into a clinically significant data into PSMA scans, which is pretty much standard of care in most of the places. The discussion part, I feel a bit already. Dr. Declan Murphy, he did a very brilliant discussion on this trial at ASCO plenary, and I suggest you guys should definitely listen to it. He's definitely very interesting. A very interesting discussion he had with looking at all the merits and the historical perspective. Also, the New England Journal paper was the discussion part was very interesting, and they did look at the most commonly talked about concern about this from this trial, which is basically keeping patient in control arm on ADT for 6 months, which is not standard of care. But they have discussed it very clearly in their paper, which is published in New England Journal of Medicine. I'll go with my personal opinion, my personal take as a clinical oncologist with a very busy clinical practice. Localized prostate cancer is something that unfortunately we are seeing a lot more in young population now than we used to have a couple of decades ago. So what's happening with those patients is that there is a very high risk of recurrence. And so prostatectomy on its own, it comes with the long-term morbidity and mortality that we are all well aware of. So pretty much half of these patients will end up getting recurrence of it either in the form of biochemical or local recurrence, and they end up getting salvage radiotherapies. The combination of prostatectomy followed by salvage radiotherapy, which is the common practice for these patients, is something which is devastating, which is debilitating, that affects quality of life, and that affects it comes with the morbidity that changes the rest of your life. And in some patients who develop distant metastasis, then they'll end up getting lifelong indefinite hormone treatment or some other treatments which can also come with a lifelong disability. So I think this trial is quite significant, and I would definitely consider it for my patients, because if there is a limited number of months they can take the ADT in combinations with apalutamide, that will reduce their chances of getting a subsequent salvage radiation therapies or subsequent metastasis, distant metastasis, making them dependent on some sort of hormone treatment for the rest of their life. I would definitely consider, especially you're talking about a drug which does not have very high chances of severe serious side effects. So I would definitely consider this for my patients. Thank you.